G'day guys, alright, another episode of Stu's Corner, bit of a rant. Right, so today, look, this is something that I see quite a fair bit in clinic, and I have to say over the years of treating especially lower limb athletes, it is something that is a bit of a regular occurrence for me. Now, if you are the first port of call for a client coming in who is complaining of Achilles tendon pain, let's do our due diligence, okay? Because once again, this week I've seen another example of this, and it's something that I see, honestly, once again, as I say, on a regular basis. So let's make sure that we do our due diligence, make sure that we get it right, and that we're doing the right thing for our clients. And this is quite simple. So obviously I'm coming from a myofascial point of view as a hands-on practitioner. We're going to be talking about Achilles tendon pain. So if your client is coming in and complaining of Achilles tendon pain, let's be sure about our assessment, okay? So with Achilles tendon pain, first thing that I always do is I'm palpating the Achilles tendon itself, okay? Which means obviously at the attachment side, the mid portion of the tendon and the way up, all right? So if it is a true Achilles pain, trust me, it will be extraordinarily sensitive. Now, also make sure that you are comparing the sensitivity of both Achilles as well, all right? So if you have a client coming in complaining of Achilles tendon pain, make sure that you put them in a relaxed position and that you're actually squeezing along the tendon. Perform the exact same thing on the other side. Now, if they don't have extraordinary sensitivity there, then there's a fair chance it isn't true Achilles pain, all right? Let's talk mimicus, okay? So from a myofascial point of view and from a hands-on practitioner, these are my three go-to, all right, straight away. So if you think that you're actually got a client coming in with something that is a pseudo-Achilles tendon pain, these are the go-tos. The first one is the gastro, okay, and especially the medial head. Okay, we have two trigger points that are in the upper, okay, so we have one up in this area here, and then we have one down more on the sort of the upper portion of the mid belly there. Now, remember that the trigger point in here, when it is hot, refers all the way down the medial portion of the gastro, down along the Achilles, and actually can refer into the foot, believe it or not, okay? That's your first one, so take your time, palpate, see if you can't reproduce that. The second one will be your tib post. Another one that loves to refer beautifully into the Achilles itself, okay? So once again, making sure that you're taking the time, palpate, find the tibia, roll off it. You know, if you've got the popliteal trigger point there, roll down another finger width, press in there, search, see if you can't reproduce some of that Achilles tendon pain. And then the third one, which is probably, as far as I'm concerned, is the most extraordinary Achilles tendon mimicker, and that is the soleus medial portion here, the trigger point that lies in here. And once again, that refers beautifully into the Achilles and also into the foot as well. So these are three trigger points that mimic Achilles tendon pain beautifully. So if you're not getting that sensitivity on the squeeze, okay, you may find that there may be a mimicker involved, so take the time to search through this tissue and see if you can't reproduce that. I can't begin to tell you how often I see that. If you do think, and they have a sensitivity in here, still explore these areas. These areas still need to be treated. There's absolutely no doubt about it. But if they have an Achilles tendon pain, work out how long it's been going on for, because it might be in the early stages, it might still be reactive, so you can get on top of it quite early. If it isn't, make sure that you are referring them off. Make sure that they're getting the right tendon rehab program. You can still treat them and offload them because they will load the calf as well, okay? But please, let's do our due diligence on our palpation, okay? Of course, they'll have pain on certain things, heel raises, all that sort of stuff. But palpation can be the key, all right? So remember the gastro trigger point, remember the tib post, and then do not forget the soleus trigger point in there. All right, guys, I hope that helps. And obviously, always, let's just check in on our assessment. Let's make sure that we're doing the right thing for our clients, because, you know, this goes under the radar. You can have clients out there who be having beautiful mimickers of Achilles tendon pain, but at the same time, they may not actually be getting the treatment that they need. All right, guys, so remember, just be awesome.